Welcome everyone to the Embedded Inequality and Inclusion EDI in your research project. My name is Linda Onerime Prince. I'm the PPI Patient and Public Involvement Manager at the NIHR Academy, and I'll be facilitating today's session. I'll pass you on to my speakers. Rebecca.
Hi everyone, my name is Rebecca Barnes. I'm Senior Research Advisor in Qualitative and Social Research Methods at the RDS in the East Midlands.
Thank you, Rebecca. So I'll pass you on to Chris.
Hi, I'm Chris Newby. I'm a Senior Statistician at Nottingham University, and I'm also a Senior Research Advisor at the RDS East Midlands.
Okay, I'll now pass you on to Pam.
Hello, I'm Pam Rees. I'm a public contributor with the RDS East Midlands, and also I sit on an NIHR funding panel as a public contributor, and I also do a number of reviews for various NIHR funding streams. Thank you.
Okay, thank you, Pam. So I'll now just discuss the overview. So today we'll be discussing defining equality, diversity and inclusion, why EDI matters in health and social care research, NIHR's EDI requirements for funding applications, and then introducing the Research Design Service EDI Toolkit. I will also have a section for Q&A, so question and answers, which you can pose questions to all the speakers in this panel, and the most questions with the highest of votes will be the ones that are answered first. So I will now pass you on to our speakers.
Thank you, Linda. So let's start off by firstly defining equality, diversity and inclusion before we get into the detail of the toolkit and thinking about how this relates to research design. So the definitions of equality, diversity and inclusion that are on the slide come from Esther Makuka, who's the NIHR's Director of EDI, and these are working definitions at the moment, which are being prepared ahead of the NIHR's EDI strategy being launched later this year. So when we talk about equality, diversity and inclusion, first of all, equality means ensuring that everyone is given equal access to resources and opportunities to use their skills and talents. And equality is very much a structural issue, so it needs us to take a systems approach to look at what we do and how we do it, and to identify and remove long-standing structural barriers which prevent individuals or groups from achieving success and achieving their full potential. When we talk about diversity, this means being reflective of the wider community. It means representing people from a broad range of backgrounds in an organisation, in a research team, in a research project, whatever it might be, in all areas and at all levels. Next slide, please. But when we think about diversity, it's really important that this doesn't become tokenistic if people aren't meaningfully included. So therefore, inclusion is absolutely fundamental. And inclusion is defined as an approach where groups or individuals with different backgrounds are welcomed, culturally and socially accepted and treated equally. It involves making sure that everyone is treated as an individual, valued on their own terms, and that people feel valued. It's about respecting people for who they are and making sure that we all feel supported to be able to do our best, to be included. So often we hear about these three terms together, equality, diversity and inclusion, as the acronym EDI. But there's also a fourth key concept, equity. Equity involves trying to understand and give people what they need to achieve their potential. It's about promoting notions of fairness, justice, entitlement and rights. Equity highlights that to enable everyone to reach their full potential, we need to treat people according to their needs and circumstances, rather than this idea, this incorrect notion that equality is about treating everyone the same. Now, these concepts might be familiar from more kind of generic equalities training that you might have done previously, but our focus today is on how to embed them in research design. So next slide, please. So just to provide some context on inclusion in the National Institute for Health Research, inclusion is one of the NIHR's 5 operating principles, as outlined in Best Research for Best Health, the next chapter, which was published by the NIHR last year. The NIHR is striving to embed EDI across its research systems and culture, and to ensure that underserved communities are not excluded from the research that it funds. Core to this principle is the recognised need for diversity amongst researchers, funding committee members and reviewers, and research participants and public contributors. But when we talk about diversity, who exactly are we striving to include? So the Equality Act 2010 recognises 9 different protected characteristics, and I'll list these. So we have age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion and belief, sex, and sexual orientation. But the NIHR also recognises the limitations of restricting diversity and inclusion to these protected characteristics alone. Other characteristics are also important, such as social class or socioeconomic status, whether someone is a carer, neurodiversity, literacy. EDI also draws our attention to disadvantaged or underserved populations, such as prisoners, homeless people, gypsy and traveller communities, and asylum seekers and refugees. The NIHR also recognises that geography matters. Research shouldn't only focus on urban areas, but needs to be conducted in rural and coastal areas. Geography also involves being mindful of how research funding is distributed. And as you might be aware, there's a frequent mismatch between the areas where disease or care burden is highest and the areas where research often takes place. Another aspect is career stage and sector. So this recognises the challenges and inequity which early career researchers can face, and the need for more support for researchers in particular sectors. And NIHR is particularly flagging public health and social care as areas that need this extra support and capacity development. It's really important that we don't view any of these categories in isolation though. We all have multiple identities, and how these characteristics intersect can lead to differences in how we might experience privilege and discrimination. To give an example, a Black gay man will have different experiences of discrimination and exclusion compared to a Black heterosexual man or a white British gay man. You might be able to reflect on your own identity and to think about where you experience privilege and in what ways you might have been discriminated against or marginalised. In addition, how included you feel can depend on the different contexts that you find yourself in. It's also helpful to start to think here about how our research participants and public contributors feel when they find themselves in environments that are perhaps comfortable for us as researchers or as practitioners. So when we ask or expect participants or public contributors to come into our spaces, our research cultures or practice cultures, to comply with our kind of processes and procedures, do they feel included or do they feel excluded or marginalised or out of their comfort zone? Next slide, please. So we're moving on here to think about why EDI matters, particularly thinking about health and social care. And over the last 2 years, we've seen health and care inequalities coming to the fore, especially given the uneven impacts of both COVID-19 itself and the public health measures to contain it. You might have seen a quote that's been circulating quite a lot about the pandemic, saying, "We might all be in the same storm, but we're not all in the same boat." This is illustrated most starkly by the disproportionately higher rates of death from COVID amongst particular groups. One of the examples on this slide highlights that people with a learning disability were 6 times more likely to die from COVID-19. The backdrop of Black Lives Matter has highlighted persisting health and healthcare inequalities amongst Black people in the UK. One of the most staggering statistics is that Black women are more than 4 times as likely to die during pregnancy or childbirth than white women. And this is only just starting to receive more attention in research and service delivery. There's also been growing criticism of medical research neglecting health conditions which disproportionately affect women. This has significant implications for delayed diagnosis, complications, and quality of life, thinking about conditions such as endometriosis. The final example is from the Marmot Review, 10 Years On, which was published in 2020. And this found that men living in the most deprived areas of the UK die on average 9.5 years earlier than men in the least deprived areas. For women, the difference is 7.7 years. This slide captures just a few of hundreds of examples that we could unfortunately give of inequalities related to health and social care. Let's move on to think about these more in the context of research. Next slide, please, Linda. So there are a number of reasons why we need to attend more to EDI in our research, and what we provide here isn't an exhaustive list. In all cases, there's a strong moral argument, but crucially, it's also good science and good economics to target areas of high need, increase the generalizability of our research findings, and widen the reach and impact of our research. So to unpack this further, firstly, our research needs to identify and target the populations and geographies where need is greatest. Choice of population and site needs to be driven by these considerations, not by ease or existing networks. Secondly, we need to better engage with those who are most marginalised and underserved in health and social care services. These groups are also the least likely to participate in research. That means that community engagement and diverse public involvement are key to build trust, increase research literacy, and understand what's important to these different groups and how we can better include them. Thirdly, conducting studies with homogeneous samples with very similar characteristics that are then not relevant to more diverse populations, causes research waste. A related issue here is whether the correct information about EDI is being collected to be able to know how diverse your sample is. This was starkly highlighted by Sean Trewick et al.'s paper in 2020, which stated that of over 1,500 COVID-19 trials registered on clinicaltrials.gov, only 6 of them were collecting data about ethnicity. This was at the time when it was already known that some ethnic groups had a disproportionately higher risk of becoming seriously ill or dying from COVID-19. Fourthly, we need to know whether some groups are adversely affected by a new intervention, even if it's effective for the majority of people. This is an important consideration with digital interventions, for example, and ensuring that there's comparable provision for those who don't have consistent access to the internet or an appropriate device, or who are not digitally literate or confident. Otherwise, what we're doing might be beneficial for a large number of people, but might actually kind of widen the gap in terms of health or care inequalities. Finally, we need to avoid harm by developing interventions which have been tested on a diverse sample. It doesn't seem to be coincidence that many drug trials continue to underrepresent women or don't disaggregate them in the analysis, and also that there are then more adverse drug events amongst women. I'm going to hand over to Chris now, who will talk about the NIHR's EDI requirements for applicants. So next slide, please.
Thank you, Becky. So the NIHR EDI requirements were disseminated on May 2020. There's 5 main points. This is the first point, that every person eligible to take part in research should be offered the same opportunity, and that's regardless of the characteristics here, and that they contain the characteristics from the protected characteristics from the Equality Act, and also additional ones like geographical location and socioeconomic status, which we know can affect healthcare and health outcomes. Next slide, please. So these are the other 4. So applicants, when they're applying for NIHR research grants, they need to document how they're collecting information on EDI, and how they're going to present that, how they're going to ask for that information. They also need to demonstrate how those EDI characteristics have been considered and addressed through the proposal. So what adjustments have you made to be inclusive for EDI in your research application and research in general? We also want that to lead to inclusive recruitment. So check your criteria, your exclusions and inclusions, and see, are you excluding anyone, and is that based on assumptions, or is that based on evidence? And you need to back up those exclusions. And then also, is this the best place for this research? Have you considered all recruiting locations? Are you doing this in the easiest place to do this research, or is there a place that's in more need or a better location for this. So is this just embedded in university hospital locations with good transport links, or can this be implemented in more rural areas, for example? Next slide, please. So this led us to develop an RDS EDI toolkit. And this toolkit goes beyond those requirements. It contains those requirements and goes beyond it. So what is the RDS EDI toolkit? It's a resource. It is for researchers and research advisors, for them to use to embed EDI into their research. It has 8 domains, which we'll go on to in a minute. These are areas in research where EDI considerations can be talked about. We developed it with input from the RDS EDI group, which contains representatives from all the areas of the national RDS. It also contains public contributors, researchers, research advisors, of which Pam is a public contributor. And the public contributors in this group co-developed the public involvement section of the toolkit. We piloted the toolkit for about 5 months in 4 of the RDS regions. And then we did feedback sessions or focus groups to find out how we could improve the toolkit. And we worked on that and developed the toolkit further. On developing the toolkit, we found that actually this is a toolkit for researchers and research advisors. It's very much an academic document, but we are creating parallel resources for public contributors around EDI. Next slide, please. So this is what the toolkit looks like. Here are our 8 domains. There's historical context and structural inequality, public involvement, research teams, selection of participant sites and samples, data collection, data analysis and presentation, dissemination, implementation and impact, and the last one, budgeting for inclusion, which we included after the rounds of feedback. Each domain contains key questions and guidance. We've included some case studies so we can see what other people are doing in terms of EDI. There's key messages there and also links to other EDI resources that within the NIHR and beyond. So we'll now go and explore each of these domains individually and give you a little bit of context around each one. So I will pass back to Becky and Pam to talk about historical context and structural inequality, or is it just Pam?
I think it's just Pam.
Okay, just Pam.
Thank you for that handover, Chris. Right, so what are the key messages for the researchers in this domain, the historical section? Well, firstly, it's to avoid marginalisation of particular groups in your research. I mean, after all, women, different ethnic groups, older people also form part of the population. And secondly, that there is the need for research to meaningfully address health and care inequalities. History shows us that research has largely been based on designs and sampling strategies that have yielded predominantly white, male, well-educated samples. Yet changes to policy and practice are commonly implemented for the whole population based on just this partial evidence. I mean, even to this very day, many studies don't report on the ethnicity, the socioeconomic status, and other characteristics of their samples. And there's already been referred to, of the 1,518 COVID-19 trials that were actually registered on clinicaltrials.gov by June 2020, only 6 were collecting data about ethnicity. And yet this is despite the fact that COVID-19, disproportionately impacts on Black and South Asian people. So once again, the needs and the perspectives of a large proportion of our population has been excluded and made invisible. Then there are the many historical health, social care and research atrocities, such as the Tuskegee study that's featured in this article on this slide, and more recent issues that include damage caused to women through pelvic and vaginal mesh surgery, issues around LGBT and conversion therapies, the disproportionate sectioning under the Mental Health Act of Black people, I mean, given such historical and structural issues, is it so very surprising then that many communities and groups don't readily trust the medical and social care professions and are wary of being involved in research, no matter how far removed and good your intentions may be? Unfortunately, there's no quick fix to overcoming this gap in trust. However, well-established approaches from the community development sector, such as community engagement and involvement, partnership working, collaboration, co-production, and building honest and mutual relations, might take time and certainly commitment, but are essential in overcoming this gap in trust. And I can speak from personal experience of just how important such methods of communication and involvement are. And I would say that such ways of working can be amazingly productive and lead to lasting, fruitful relationships for further research and future research. However, for many researchers, this may seem a daunting task. You know, we're all sort of more comfortable in our comfort zones, but don't despair, because alongside the toolkit, there are agencies, including the RDS, practitioners, NIHR guidance out there with the knowledge, experience and skills to support you. Next slide, please, Linda. Thank you. Right, public involvement. Now, this section of the toolkit has been developed by public contributors, Cecil Henry, Beauty Schumer, and myself, amongst others. And from a series of discussions, we arrived at 3 overarching questions for researchers to work through. The first is, how aware are you of EDI issues and public involvement? And you might call this a plea for allowing yourself the space for self-reflection. Don't worry, it's not going to be touchy-feely stuff, but learning about the communities that you wish to involve rather than diving straight in. And here you're being asked to consider issues such as your own training needs, the time and resources you will need to allocate to address EDI in public involvement, your understanding of the barriers that communities have in engaging in research. Now, we've already referred to some barriers, historical issues, marginalisation, and so on. However, beware of making assumptions before you, begin to understand your community. You need to be aware of the local issues that exist that may be barriers to the actual communities and groups that you're wanting to involve. So it is, not, as I say, not making assumptions and just applying the generalizable to individual groups and individuals. Spend time to find out what their individual issues are. You'll also need to consider things like the strengths and weaknesses of different engagement methods. We have consultation, participation, collaboration, co-production, user-led, partnership working. And, for a lot of people, they are confusing terms. So it's reading up, talking to other people about it, and then you don't just apply, something because it sounds interesting, or you might think that it will earn, special recognition from a funding panel. You need to choose the engagement method that suits your research aims and the needs of the marginalised communities you want to involve and reach out to. There is the advice that working together to, in participatory, co-produced work might be particularly, valuable when engaging with marginalised communities. That means not going in just with your script, your needs, but, trying to understand and work alongside with them on things that are priorities for that, community themselves. I mean, that's particularly useful if you have, a community or group that has just got a history of being disempowered, of being excluded. Nevertheless, The time commitment can't be underestimated and needs to be budgeted for. And the second question is, how will your PPI strategy enable you to recruit and retain diverse public contributors? And this section encourages researchers to consider how their activities might inadvertently exclude some groups, the very ones who are too often inappropriately blamed for being hard to reach. And so it's encouraging you, to consider more effective ways of reaching out. I mean, just as you usually seek a diverse research sample group, perhaps recruiting patients or service users from multiple sites, it's the same approach with, when you're involving or wanting to involve public contributors. The ones that are most accessible, perhaps those that belong to an existing patient or user group, or the ones that, are eager to come forward, may lack diversity. And, diversity is important. Not everyone speaks from the same mindset with the same voice. They come with different backgrounds, issues, experiences. And it's that richness, that you need in informing, your research. And the toolkit provides useful ideas and suggestions on how researchers can build genuine relationships with community organisations and how these can be reciprocal and sustainable beyond the life of the project. You need to be honest about the potential benefits of research to them, and don't overpromise, and so that you do maintain the trust of the community. And the third question is, how will you support and empower your diverse PPI group? And this covers issues such as respectful communication with public contributors, so they're clear about what's expected of them throughout the project, not seeing public contributors as just simply fulfilling a quota or speaking for their community or protected characteristic. And I would add that, there's often a lot made of working with gatekeepers to communities. Gatekeepers, are worthy of respect, can be very useful for you, but don't feel that, one person can speak for a community or just a particular select few can. You need to widen your scope. And awareness of the impact of power hierarchies and the importance of the fairer approach of working with people, and conducting meetings in the community, e.g. social, recreational, cultural, faith spaces. And it requires researchers to take themselves out of their comfort zones. But, doing that, I think was it Einstein said, is the most important tool in learning. Anyway, on that note, I'll pass back to the next speaker, please. Thank you. So it's the next slide.
Thanks so much, Pam. That was really insightful and really helpful. So it's back to me for the third domain, which is research team. And I can see that there's a couple of questions or comments on the chat already about research team and the importance of recognising diversity in the team. So our toolkit highlights some of the benefits of diverse teams, and researchers are encouraged to think about how diverse their team is, which, when we've been developing this toolkit, we found that for some teams and for some researchers, that's been quite a confrontational suggestion, and it's been challenging to kind of have some of those discussions. Whilst this domain might seem more relevant to the formation of larger research teams for grants, it's also relevant to thinking about the voices which are surrounding researchers who are applying for career development awards, such as fellowships. So are you including mentors or supervisors who, in addition to their academic and practice expertise, may be able to bring different vantage points to your research because of their diversity of perspective and lived experience? It is important, though, that this is a nuanced argument. So on the one hand, there's a potential lack of credibility if you're researching, for example, lesbian, gay, bisexual, transgender people's experiences of health without an LGBT plus identified researcher on the team. And certainly in my own research experiences around sexuality, some participants have wanted to know about my own identity before they've agreed whether they would take part in an interview or not. And so that kind of shared identity has been important. Equally, it's really important not to assume that one individual can be a spokesperson for any community. And even if they do belong to the community or group being studied, we can't assume that they're going to understand different needs and perspectives within that community. So for all researchers, demonstrating cultural competence, or sometimes it's referred to as cultural humility, is absolutely key. It's also not always possible to have a senior research leader from the communities that are going to be studied that represent those communities. So, for example, there are very few Black professors in the UK, and I can see that someone in the questions has also highlighted the barriers to career progression and research opportunity for disabled researchers. There are alternative approaches to ground the team in diverse perspectives, including recruiting and training community development workers or peer researchers to be a bridge between the community and the research team. And that can be really valuable in order to kind of help to build rapport, build connections on the ground. Finally, it's really important to see and to demonstrate how diversity has made a difference. With all of these discussions of EDI, there's a danger of being tokenistic, of seeing it as a box-ticking exercise. And as with public involvement, it's really important to show how co-working with diverse stakeholders has shaped the research priorities and the research design. I'm going to pass back to Chris now, who's going to talk about selection and sampling.
Hi, so sometimes in research we want to carry out studies on a very homogeneous sample because this reduces variation in some of our outcomes, and as from a statistical point of view that might make sense, but what we might end up with is an intervention or a piece of research that only works on that homogeneous sample, and when we come to implementation later on, the sample is not generalizable, so the intervention isn't generalizable, and there isn't sometimes a budget to generalize that to the whole population. So when we're selecting our participants, we need to check our inclusion and exclusion criteria to see if this is justified. So sometimes it is, like I work with ASPA research, and we tend to not recruit people under 5 because it's very difficult to get objective measures, lung measures from under 5. It's called preschool wheeze. But then there are other things around apps where older people, people over 60 or 70, are excluded from those kind of studies, digital interventions, because the assumption is that they might not be that computer literate, whereas that actually might not be the case at all. So you need to justify those inclusions and exclusions, and whether you've got your own internal biases for those. And you also want to check, has geographical need informed your choice of studies? Are you doing this at the place where it needs it the most, or is it just the most easiest? So you could look at some of the stop smoking research and see, oh, am I doing this in the place where there's the most prevalent smokers? And then also you want to demonstrate that you're doing this diverse recruitment, if you like, or inclusive recruitment, by collecting EDI measures and then displaying them. So you've got those participant details, and we'll go into that a little bit more on the data analysis sections. So next slide, please. And I will pass you back up to Becky.
Okay, yeah, so back to me. Thank you, Chris. So the fifth domain addresses data collection. And the way in which we've approached this is kind of twofold, really. We've considered kind of practical considerations to increase how inclusive and accessibility research studies are and to improve the participant experience. We've also considered choice of methodology. So beginning with practical considerations, these are really just a selection because it's very much dependent on your study design and your population. But some of the issues to consider include language and communication. And so that might include whether you need to translate any documents into different languages or produce videos in different languages, given that not everyone is going to be literate in the language that they speak. Using interpreters and some of the protocols around using interpreters, so the need for kind of thorough briefing and debriefing, for instance, whether it might be more culturally appropriate in some contexts to provide a verbal rather than a written kind of briefing about the research, thinking about provision for those with low literacy and making information accessible to those with learning disabilities. It's also quite often that you see that the only way to contact the research team is via email. And so if we do that, then who are we excluding? Time and place are also key. And where possible, we need to offer flexible timings for research and intervention activities and be prepared to make these available at evenings or weekends. In terms of physical accessibility, can follow-up appointments or intervention activities take place in local GP surgeries or other community facilities? What provision is there for people with care commitments? Are venues physically accessible? And there are also cultural sensitivities, and it's important to acknowledge taboo topics and also not to restrict what we consider to be a taboo topic, because depending on which community or population you're engaging with and seeking to recruit into your research, the topics that are stigmatized or taboo are not necessarily the ones that we might always expect. There might be a need for single-sex focus groups or perhaps age-stratified focus groups or intervention activities. There might be a need for choice of interviewer. Where possible, it is really about choice and flexibility, recognising that everyone will have different requirements and preferences. Certainly not an exhaustive list. But as we've kind of thought about these considerations for inclusivity, I guess it's made us reflect that to what extent are we just kind of tinkering at the edges of conventional methodologies and trying to make them more inclusive? And although there's a benefit to that, maybe we need to think more outside the box, and as other, as many researchers are doing, kind of adopting kind of user-led approaches, adopting creative approaches such as arts-based methods, and photo voice, participatory research approaches. It's not always going to be appropriate for every study, but there are a number of situations where there's an over-reliance on kind of verbal communication that can pose a barrier to participation. I'll hand back to Chris now, who's going to talk about data analysis and presentation. So next slide, please.
Thank you. So this is about how will you analyse and report EDI characteristics. So sometimes, especially in quantitative analysis, you collect participants' demographics and characteristics and display them in a kind of table 1, if you like, and then you don't really refer back to them. But this information can be used maybe to generate subgroup analyses. So at first, this as a statistician, you grab alarm bells because it's we don't really like subgroup analysis; they're underpowered. But I'm not talking about hypothesis testing for subgroups. I'm just thinking about an estimate for those. So you're leaving that subgroup data out there if people are doing a meta-analysis, so they can pick up on that for specific groups of people and add that in. And a few journals are actually advising this now for trials to do subgroup analysis for race and gender. So with that, you're describing your EDI characteristics, but how are you doing that? Are you using the terms that you've decided are appropriate, or are you communicating with those people with those characteristics to find out what people like to be called. It's always difficult, especially using medical jargon, and that can sometimes leak into categories of people, which isn't very nice for the actual people. So if you have diverse PPI, you can talk to your diverse PPI and you can find out or have those difficult conversations about what you'd like to present around the protected characteristics. And once you've got your results, you want to discuss this with your PPI group, and you wanting that PPI group to be diverse, because what happens is you can create a narrative around a story, but then you have unconscious biases, and without that diverse representation, you can maybe have an offensive narrative around the results or anything. So just having that conversation with diverse people is brilliant. And it might lead to more fruitful results or fruitful grants in the future. And I think I will go, oh yeah, next slide, please, Linda. It's okay. Right, we're on to dissemination and implementation. So the NIHR describes dissemination as an active approach to the spreading of research findings to the target audience via determined channels using planned strategies. So we would like to see inclusive or diverse dissemination. So we're wanting lots of kind of infographics and videos, and so it reaches everyone. And I'll pass to Pam now, who is going to give us a little bit of an example of what she looks for in dissemination when reviewing. Is that right, Pam?
Thanks, Chris. This is, for me, and not just for me, but a really important part of any research funding proposal. But unfortunately, from my experience, it's a section that's often poorly considered by the applicant. So when reviewing or assessing NIHR funding proposals, what we need to see is evidence that the key messages of the research are going to be communicated appropriately to reach as wide an audience as possible. Now, that certainly includes the communities who've been involved as public contributors or participants, charities, interest groups who have got a specific, a special involvement or interest in the research. And this is important, in the long term as well, for sustaining relationships and ensuring that underserved communities are not left feeling shut out of the outcomes of the research and excluded once again, and that their trust and goodwill has been exploited. You don't want the situation where you come in, do the deed, go away, and leave them wondering, well, what was all that about? So rather than excluding people on the assumption that they won't be interested in your research findings, I'd argue that you should reach out to explain these findings to, as I say, a wider audience as possible. So you're thinking in terms of inclusion rather than exclusion. And my second piece of advice regarding your proposal is that it's not enough to simply provide a list of who you're going to share your findings with. I mean, I see this times many. We will share our findings appropriately with blah, 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 blah. And it's simply not enough to say that you're going to make these findings accessible and appropriate to their needs. What you need to do is back that up, back your claims up with evidence of how you're going to do this. So it could be, academic papers to an academic audience, but also executive summaries, lay summaries, infographics, video, blogs, in discussions with community groups at times and venues, places, be it a community centre, health centre, social club, school hall, temple, church hall, mosque, whatever is appropriate and convenient to your target audience. And by using varied formats and media and budgeting for translation where appropriate into different languages, your results can reach further and influence people who've either been disillusioned with research or who've had little opportunity to engage with it. So, you're diversifying. And I'd also like to emphasise that it's particularly important that you explain in your proposal how you'll take your research findings back to the communities who've been involved as public contributors, and that you outline the next steps to them. And so depending on who's been involved in your research, you may need to consider things like easy read formats, digital accessibility, audio, video formats, and as Becky has already spoken about, more engaging and innovative outputs, especially for children and young people. So thank you. I'll hand you back to Chris now.
Thanks, Pam. So as well as, just back one slide, sorry, Linda. So as well as dissemination, we have implementation. And as I said before, if you get it right at the beginning, then the implementation will be a lot easier because you don't have to adjust for anything for heterogeneity. But there's also impact. So impact is the demonstrable contribution that research makes to society and the economy, of benefit to individuals, organizations and nations. And what we'd like to see is impact for all, and also the people who have health inequalities are likely to have the best impact if you do the research right. So we're wanting to see how that impact is on people with protected characteristics. And I'll go on to next slide, please, because I think we're running out of time to Becky and budgeting.
Thank you, Chris. So the final domain, budgeting for inclusion, has been added to the toolkit following feedback on the originally piloted version. What we found was that there was a strong appetite to develop more inclusive research, but concerns about how much this would increase the research costs and whether factoring in these costs would make a bid less competitive. And again, I can see in the chat and the Q&A that there are a number of kind of comments, or queries or concerns about the resourcing of EDI, and it is a really critical issue, and we're certainly not there yet in terms of being very clear about what can and cannot be costed for. The message that we have received from a number of funding committees within the NIHR is that EDI is increasingly being taken into account when bids are being reviewed, and that the reasonable costs of conducting more inclusive research can be met if clearly justified. The toolkit maps some of the potential cost and time considerations against each of the domains, and we'd encourage you to have a look at this kind of individually for your project, as not all costs will be relevant to all projects. But to give a few examples, fellowship applicants might want to consider including cultural competence training into their training plans. Conducting more inclusive research might mean paying to hire community venues for focus groups or interviews, covering care costs. It might involve extra time to recruit from underserved groups, and that can then have quite a knock-on effect on the project timelines and staffing costs. I'm going to ask Pam, as a public reviewer on a funding committee, what do you look for when it comes to budgeting for inclusion?
Thanks, Rebecca. I'll keep this really short and simple. My main issue is that all too often the only information provided in research funding applications as regards the budget section in connection with PPI and EDI is that all they do is just give an overall lump sum of how much funding will be allocated for equality, diversity, inclusion in public involvement. So there are no individual budget lines to evidence exactly how this money is going to be allocated. And it's, as I say, with dissemination, often these points are just glossed over. We want to know the hows. You know, okay, you say that, you know, you're going to spend this amount of money on this area, but how is the money being divvied up? Where is it going? You know, you need to prove that it's being spent appropriately, that you're budgeting well, that you've been thoughtful, you know. So often I'm left guessing, you know, is this funding for reimbursement of public contributors' expenses? For example, their IT and printing costs, travel, care costs, or is it an honoraria? Or is it for public facing material, promotion, venue hire, refreshments, translation. You know, if you're left thinking, well, I don't know, you know, to me, it just sort of puts me on high alert. And I often wonder whether this is because applicants are unsure of how to budget for this area. You know, do they lack the awareness, the understanding, or is it because they don't feel it's that important and therefore it doesn't warrant the detail? So commitment to PPI and equality, diversity, inclusion is not simply expressed in words and claims. It requires appropriate resources. So please provide that evidence in your proposal. And I'd urge all applicants to use the RDS EDI Toolkit and to consult the web for NIHR guidance on budgeting for PPI and equality, diversity, inclusion. Back to you, Chris. Oh, sorry, Becky.
That's super, thanks Pam, really helpful. Just to add that we do also offer some suggestions in the toolkit for how costs can be reduced. So we kind of caution against a blanket assumption that all research materials need to be translated into multiple community languages because of the issue that we mentioned earlier around, you know, rates of literacy varying in those languages. Paying and training community engagement workers can also be very rewarding, can really help in terms of recruitment and engagement in the research and be cost effective, as well as bringing fresh perspectives into the research team. And we also encourage researchers to look at whether translated versions of their chosen outcome measure or an acceptable equivalent exist. There aren't easy answers to the question of resourcing, just to preempt the discussion that we'll have shortly. What we can say is that the more that EDI is embedded into our research practice and the more that inclusive practice becomes normative, the less cost and time intensive this will become in the long run. And that's what we're aiming towards. Next slide, please. Thank you, Linda. So we're just ending with a few links. So I've already shared it in the Q&A, but the link to access the RDS EDI Toolkit is on this slide. The Research Design Service, who we're all from, can advise on all aspects of your research design, including EDI. So if you've not worked with us before, then we can support any applied health or social care researcher in England who's applying for national peer-reviewed funding. We can work with you for however long before you submit your application. We can offer specialist advice on all aspects of your methodology, including EDI and also public involvement. We have some funds to support pre-application public involvement work, and we can review your application and sort of, work with you however much you need, really. There's some other useful resources. There's the Include Ethnicity framework from TrialForge, particularly useful for trialists to think about which groups need to be included in their trial. And then there's the NIHR Include initiative, which includes an online training course about underserved groups and how to reach out to underserved groups. And then there's the Centre for Ethnic Health Research's Toolkit for increasing the participation of Black, Asian and minority ethnic communities, which is a really comprehensive resource. And the Centre for Ethnic Health Research also offer cultural competence training and community engagement training, as well as support with interpretation and translation and public involvement in research. So do have a look at what they offer. So this brings us to the end of our presentation.
I'll be closing the webinar now, but first of all, I want to thank our speakers. So I'd like to thank Rebecca Barnes. She's very instrumental in putting the webinar together and the designing the content. I'd also like to thank Christopher Newby as well. He works well alongside with Rebecca, and he was very instrumental as well with putting the content, and our public contributor also contributed to the content as well. So I'd like to thank 3 of our speakers. I'd also like to thank Jeremy Taylor for coming in from the Center of Engagement and Dissemination and answering our question, and that was really, really helpful to have him on there. And I'd also lastly like to thank our comms team, James, who's been very instrumental, James, our comms officer, with putting all the behind the scenes and making sure everything functions properly. And I'd also like to encourage everyone to please complete our survey. It really helps us to improve our webinars going forward. And then when in the survey, if you would like to receive a copy of our slides, so please just leave your email address and then I will send that to you. And I'll also look at the Q&A questions. I know we had a lot of questions today. So when people have left their names, I will be able to get back to them. So refer to some of my other colleagues in NIHR as well. But if you've asked a question anonymously and you still want it to be answered, if you could send an email to the public recruitment email address. So that's publicrecruitment@nihr.ac.uk. But I want to thank everyone for attending today. Thank you very much for your time.